Mr. Speaker, this morning I rise today to provide this Honorable House with an update on my ministry's intentions regarding the Financial Assistance Program. As you know, it is the government's intent to reform the program, and this initiative was included in this year's throne speech. However, the work was begun last year with the establishment of the Financial Assistance Reform Group. Mr. Speaker, the Reform Group worked diligently and produced a final set of recommendations detailed in their Financial Assistance Reform Group Recommendations Report. When the Department of Financial Assistance was moved to the Ministry of Health, we reviewed the recommendations and Cabinet has accepted a number of them, which will pave the way to reform the program. The report has been published on our website along with details of the recommendations that will drive our reforms. But first, Mr. Speaker, I want to set the context about the Financial Assistance Program, as I've found that there are many misconceptions about the program and the population it serves. To begin, Mr. Speaker, I think the public would like to understand that most financial assistance recipients are seniors, disabled persons, and child daycare recipients. Only 26% are able-bodied adults. In fact, as of January 2019, there were 3,268 recipients in total, and the breakdown is as follows, Mr. Speaker. 1,184 were pensioners or seniors, 896 persons were with disabilities, 214 were able-bodied employed, 362 persons were low earnings, and 612 were child daycare allowance recipients. Financial assistance is committed to making work pay, and its award structure provides a foundation for this, as persons do not lose all benefits if they find some form of employment. More work is being done to advance this policy to help get more people back to work. Mr. Speaker, when the Reform Group was first established, its intended purpose was to reduce abuse, discourage dependency, and ensure that work pays. These are important goals. However, in light of the profile of the persons in need of such assistance and the type of supports granted, it has become clear that the focus of reform should be on making the program financially sustainable, improving efficiency, and ensuring a more equitable allocation of awards. Our decisions have been guided by the internal audit report completed subsequent to the Reform Group's conclusion. There were a number of overlaps between the two, but together and in light of the appointment of a new Director of Financial Assistance, we have been able to have a more focused and targeted approach to achieve the most impactful reforms. To begin, Mr. Speaker, the internal audit report recommendations are being acted on immediately to bring urgent, essential improvements as soon as possible over the next 12 to 18 months. These have already begun and will reduce waste, control budgets, and improve service to recipients and applicants. For example, Mr. Speaker, a working committee has been set up to improve the current database system and use technology to improve efficiency in the future. Customer service training is being sourced to commence this before the summer, because we want all of our workers to have a courteous, sensitive, and professional approach towards our clients and their needs. A new intake process is also being implemented. The Department has reviewed their pre-screening process, and the new system should reduce the time that clients will have to sit for their initial interviews. Further, a 30-day window has also been implemented so that clients will receive a response in a timely manner. Job search sheets have been replaced with mandatory usage of the Bermuda Job Board. Clients are expected to visit the Department of Workforce Development, meet with a career development officer, have their resumes updated, participate in skills testing, and search for employment opportunities on the job board. Evidence of this activity must be submitted to the Department of Financial Assistance to qualify for a financial award. Mr. Speaker, in addition to these operational improvements, we will be strategically focused on ensuring a more equitable allocation of awards and achieving financial sustainability of the program. In this regard, a fundamental reform will be undertaken is to change the formula that is used to determine eligibility and awards. Specifically, we will amend the legislative formula to establish awards so that eligibility is based on measures associated with the low-income threshold as calculated by the Department of Statistics, rather than the current allowable expenses minus qualifying income equals the financial assistance award. Further, Mr. Speaker, as Minister of Health, I want to see changes that will discourage the purchase of non-nutritive food and beverages, as is currently done with tobacco and alcohol. and I would like to find ways for the government to recover debt and/or set off the cost of benefits through the property of deceased financial assistance recipients. Mr. Speaker, as a country, we can no longer afford for the state to subsidize persons' inheritances as currently is occurring. Mr. Speaker, honorable members, as you will know, the financial assistance program is vital to our community. It is the only form of welfare available to assist the vulnerable, frail, and infirm, and the only means to prevent families from descending into poverty. However, funds are finite, and we have to make sure that we use them efficiently and that they reach the right people. We expect that the reforms underway will change the face of the program to achieve financial sustainability and a more equitable allocation of awards. Thank you, Mr. Speaker.